What's going on, everyone? Wanted to talk a little bit more about wide receiver for the Cincinnati Bengals, T. Higgins, and his hamstring strain. So, not only is he on my fantasy football team, but he also plays for my hometown, Cincinnati. And so, I want to go over a little bit more about what hamstring strains are and some of the more subtle nuances that oftentimes don't get discussed, making them a little bit more of a trickier injury sometimes than they may lead themselves to be. When we talk about hamstring strains, we categorize them into three different grades. So, grade one being sort of like an overstretch that's gone a little bit too far. Grade two is a partial tear within the muscle belly itself. And then grade three is a full tear through the muscle. During practice the other week, T. Higgins pulled up short with a hamstring injury. And so they then later diagnosed him with a hamstring strain. Based off of some of the timelines that we're getting from the sports medicine staff, we're likely to assume that it's probably between a grade one and a grade two. Grade three strains are very, very rare and are sometimes treated surgically as well, but grades one and two are typically managed non operatively. When we talk about a hamstring strain, what's occurring from a microscopic level is we're actually undergoing small tears within the muscle itself. Those small tears then reproduce some bleeding in there, which is why sometimes people will experience bruising afterwards. And then your body has to lay down a scab or some scar tissue in there as well. So when we talk about how hamstring strains occur, it typically occurs during some type of sprinting style maneuver. So as we can see with this picture, when you sprint, your leg has to extend and your hamstrings control the rate or the speed at which your leg extends. That requires a lot of eccentric strength for your hamstrings. What can happen sometimes is people will stride out and they'll overstretch that hamstring muscle a little bit. And then as soon as their foot makes contact with the ground, they then have to activate their hamstring. And that can also result in a pull or a strain of that hamstring muscle as well. And this seems to be what happened with T. Higgins. During practice, he seemed to be doing a lot of acceleration, deceleration drills as required for him as a wide receiver. And so what likely happened is he probably tried to stride out. And then as soon as he overstrided, he ended up having a tweak or a strain of that hamstring muscle. So like we mentioned earlier, a hamstring strain is essentially when that muscle gets overstretched a little bit too far and you create these small micro tears within the muscle. Usually, most players do not undergo an MRI for a hamstring strain unless there's concern that there is a full thickness grade 3 tear and there's potential considerations for surgery or surgical management. This is just an MRI that was likely done for a professional athlete. A lot of professional athletes will get an MRI on any muscular injury because it can help the sports medicine staff more accurately diagnose and then more quickly return the athlete back to play. Can be expensive as well. So that's typically why most people don't even feel like they need an MRI for something like a simple hamstring strain. However, as you can see through this picture, that white spot that we see right through this person's hamstring, that is indicative of a small amount of tearing that occurred within the muscle. And the white is basically a little bit of some fluid or some swelling that occurred after those microscopic tears. What will then happen is once that swelling goes down, your body will heal those microscopic tears with a small amount of scar tissue, kind of like if you cut your skin, you'd form a scab. This is the same concept that occurs within the muscle itself. So now what's going to happen is it's going to be paramount that we eliminate some of the scar tissue once enough healing has occurred, and then we really focus on laying down healthy tissue in place of that scar tissue. Once we eliminate that scar tissue, lay down healthy muscle tissue on there, we then have to make sure that that muscle is strong enough to keep up with the demands for whatever sport we're going back to. Typically, that sport will involve some type of plyometric or sprinting. So for example, T. Higgins being a wide receiver, he's going to be required to do a lot of acceleration as he runs his routes and has different patterns of play out on the football field. This is why it's paramount after a hamstring strain to make sure that we get the athlete strong enough. If there's any strength deficit when the athlete attempts to return to play, the hamstring muscle is at risk for re-tearing again. In fact, a lot of hamstring strains occur because the hamstring muscle itself was a little bit weak. Sometimes it could be true weakness, like when we think about doing like a hamstring curl, like a machine on the gym. Most of the times, though, it's weakness within the muscle to lengthen under tension, like what we saw with that sprinting mechanism, as your foot extends right before it makes contact with the ground. As that knee extension occurs, then that's oftentimes when the hamstring is most vulnerable and is called upon the most. And so this is why things like Theraguns, foam rollers, passive stretching, things like that won't necessarily get the athlete back to the field of play in an appropriate manner. We have to really make sure that we eliminate the scar tissue, build up muscle tissue, and then restore that true muscular strength, especially during sprinting. Now, sometimes we'll hear people talk about how their hamstrings are always tight, or even after a hamstring strain, they'll feel like that hamstring is constantly tight and it never seems to relax. Sometimes that could be due to a mechanical issue like hamstring strength, like we mentioned in the last slide. And that can also be due to any type of mechanical insufficiency or biomechanical patterns in the way that people move or they run. There is a third reason why people can feel that chronic tightness within their hamstring, and that's due to the sciatic nerve. So, your sciatic nerve is basically a big superhighway that forms from the lower part of your lower back and the top part of your tailbone. And those nerve roots merge like a big superhighway or electrical pipeline that travels through your buttock and then down into your hamstring. Now, it's responsible for generating that nerve muscle connection to your hamstring muscles to make sure that those muscles feel supple and they feel loose, as well as making sure that they can activate and have a lot of that explosive power as well. So if somebody is constantly complaining about tight hamstrings, make sure to check their biomechanics, make sure to check that their hamstrings are strong enough, and then also make sure that the sciatic nerve is not involved as well. And so hamstring strains can actually have a neurogenic or a nerve tissue involvement as well as to why people ended up with a hamstring strain to begin with, or even recurrent hamstring strains. So one of the ways that the nerve can be involved in a hamstring strain or a second or third or recurrent hamstring strain is through the nerve root. So your spinal cord is encased by your spinal column, the bones of your back, and the nerve roots exit between each space between each of those building blocks within your vertebral column. And so what can happen sometimes is the nerve root, as that nerve exits the foramen or that space between your vertebral segments, that nerve root can sometimes become irritated. Sometimes that can be caused by a herniated disc, although what we know is that disc pathology in athletes is very rare unless there's some type of acute trauma, like some type of forceful bending, twisting, or lifting style injury. Most of the hamstring strains that involve the nerve root is more of like a pinched nerve phenomenon, where that sciatic nerve or the root of the sciatic nerve as it exits the spinal column gets pinched right where the vertebral segments are. And that's something that we call lumbar radiculopathy. And that can be one cause of nerve-related hamstring strains that involve the sciatic nerve. The other way that nerves can be involved in a hamstring strain is through sciatic nerve entrapment, which now we're not talking so much about the root of the nerve as it exits your spinal column, but more the sciatic nerve itself as it travels across the back of your hip through your buttock, as well as into the hamstring muscle itself. Sometimes that sciatic nerve can become entrapped. It's kind of like a big electrical pipeline. If you step on a garden hose, you decrease the flow of the water. Same thing, if you entrap or you impinge that sciatic nerve as it flows through your buttock or hamstring, you're going to have a decreased nerve signal to the muscle of your hamstring, which can then predispose it to some type of injury, in which case we talk about a small tear in the muscle as it's trying to forcefully contract in the way that we talked about with sprinting. So what we want to make sure of is that we rule out any sciatic nerve involvement with a hamstring strain. Even if it's somebody's first strain, even if it seems like it's a mild or grade 1 strain, it's going to be really important to rule that out. We have some ultrasound studies that have shown that the sciatic nerve can actually move through the soft tissue and can become entrapped or impinged within the soft tissue as well. They can visualize that with musculoskeletal ultrasound images. So if somebody's sciatic nerve is involved in a hamstring strain, we want to make sure that we can floss or glide that nerve to free it up, kind of like flossing between your teeth. So to summarize, some key things that we're thinking about when an athlete presents with a hamstring strain is we're going to try to grade it as a grade 1 or a grade 2, or hopefully not a grade 3 where there's a rupture of the muscle. Most hamstring strains are either grade 1 or grade 2. Grade 1 hamstring strains take anywhere from about 3 to 5 weeks to recover. Grade 2 hamstring strains take about 4 to 8 weeks to recover from. Given that T. Higgins was out for Thursday's Bengals game against the Ravens, we're not sure whether he has a grade 1 or a grade 2, but we know that it will be a few weeks before he comes back. Some things that we're going to be thinking about are going to be to make sure that the hamstring strength return. So we need to eliminate the scar tissue that occurs after that small microscopic tear within the muscle and that scab forms. And then we have to make sure that the strength and the range of motion improve, as well as that eccentric or lengthening under tension. So that's why you see a lot of people that will do Nordic hamstring curls, single leg RDLs, those type of exercises that are going to lengthen the muscle while it's undergoing tension, and that will help to reproduce the mechanics that are required when you sprint. Then we're looking at things like ankle and hip mechanics. We're looking at things like strength of the glutes and the hamstrings and up and down the lower extremity kinetic chain. And then we're also ruling out any sciatic nerve involvement. And if there is any sciatic nerve involvement, addressing those tissue structures as well.